we are now, you said, approximately a year out of surgery.
For the right hand, correct.
Right hand.
Yep.
And then how far out?
And we did the left one about 6 months later. So
Wow.
about 6
So
months
this
out
is only
from that.
6 months
Yes.
ago, and this is almost a year ago.
Yep.
Wow, Arden, that has been a very quick period of time. And what do you think you noticed the most about her fingers?
I mean, she's able to hold writing utensils, and right now in school, she's learning how to write her name and draw. Her drawings have gotten so good. They look like what she plans for them to look like.
Wow.
That was something that was a struggle before. She can open doors now, like turn a doorknob and open it. She can peel her own bananas and
Peel your own banana?
Yep, open a jar of slime, whether we want her to or not.
Before we did the surgery, what was her positioning of the hands, or what were the major
They were pretty
closed?
clenched. She could still open them, but she mostly used her thumb, forefinger, and pinky.
Yep.
The middle digits have always been the tightest, and so they held everything down and kept anything from opening all the way. I would have to tell her to open her whole hand, and she could try, but it would still only go like here.
I get it.
But she could use, so she like pincer grasped everything.
And you mentioned when she was born and you looked
The
at
baby.
her hand the first time.
Yeah, when she was a baby, her hands were completely seized closed like that, yes.
Yeah.
And I would have to sit there when she was in the incubator just holding her hand like this to now be able to hold her hand and actually walk down the street with her and holding her hand. It brings a tear to my eye every time. Yeah.
The NICU doctors actually thought that her fingers might be fused to her palms at birth.
That's how
They were
tight
like
it was.
little spirals. Like I
It was-
can't even make my fingers do the spirals that hers did, but they were like totally spiraled in. I wasn't sure
And
there were bones in there.
Tight. Like,
So tight.
Very tight.
We used Q-tips with bacitracin on
Just to
them,
clean
and
the
I
skin.
would, just to try and open her in the beginning. That's all I could fit in there.
It
And
was-
her nails on the inside were so soft, they never touched air, so
Right.
they never hardened.
I get it.
So her nails inside her palms were so soft for months and months after she was born, because I still had never been in air.
See?
Was there a moment of time when you first saw her fingers that you would think this is never going to
I
correct?
never thought it was going to be corrected. I always thought she was going to be, her hands were going to be closed.
Just have a clenched
Yep.
Yeah.
fist forever. And the fact that now she could open all her fingers
She could high
It's
five.
and
amazing.
high five and get
Yes.
to that part.
Yes.
It's
Yeah.
pretty unusual.
We
The
are
good
so
news
grateful.
is I expect it to continue to improve, and she's doing beyond my expectations for this period of time,
Awesome.
6 months in a year.
I'm thrilled to hear that.
I'm looking forward to this next year.
Yeah.
Because I think it's going to be exponential growth, and I think she's going to do wonderfully.
We're very, very thankful to you for everything you've
And
done
then
for her hands, and then some.
So,
It was a long road finding a hand doctor who could help us, and you've been amazing.
I'm glad I
amazing.
could help you guys
Thank
out.
you.
That was a big pleasure for me also to
Come on, Bob.
provide you with that.
Yes.